The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
Well, in the midst of the coronavirus pandemic, what happens if you need medical help? Well, we have Jeff Mearsman here from Gold Cross Ambulance joining us live this noon hour with when to call 911 and when to call the COVID hotline. Okay, Jeff, when should we call 911? Things have changed.
So we are asking the public that when you have any sort of emergent or new onset of medical illness such as chest pains, difficulty breathing, shortness of breath, visual disturbances, difficulty speaking, confusion, seizures, low blood sugar, anything that is an out of the normal instance for you, is to please call 911. We will respond and we will assess the situation to determine what needs you have and get you to the closest emergency department if necessary, or transport you to another facility if that is also necessary. And so that's kind of what we're truly looking at, is we want people to still know that for all their emergent needs to please contact 911 immediately, and we will respond and evaluate the situation as we always do.
So normal, like a broken bone or a bad cut, you should probably call 911,
Yep,
right?
Still call 911 for those, yes.
And you really don't want to go to an emergency room right now.
We're assessing and working with the emergency departments on their bed counts and their surge capacities with online medical control, as we call it, to determine if patients need to come to the ED by transport, or if we can refer them to a secondary facility like an Instacare or urgent care for stitches, as you said, like for a cut. But a broken bone, we'll transport you to the emergency department so that they can set and take care of that.
Okay, we have the COVID hotline number on the screen right now. When should people call the hotline? Any questions?
So if you have mild symptoms or you feel like you've been exposed to someone who possibly has it and you're just exhibiting those mild symptoms or have concerns about whether or not you've been exposed to it, is to call the COVID hotline. We want to reserve the 911 system for emergent symptoms related with COVID. But if you just have questions, are concerned, want to check your symptoms and potential exposure, to please call the COVID hotline, because they will refer you back to the 911 system if you have symptoms that need to be responded to and evaluated and transported.
Perfect. Okay, Jack Mearsman, thank you so much for joining us this noon hour. We have a lot of those resources on our website as well.